Doc?
Johan, watery eyes. He was looking, excuse the pun, for some advice because besides his kids thinking he was crying all the time, having itchy eyes was really bugging him.
You see, we all need tears. Emotional ones can be debatable, but physiologically they're necessary for the lubrication of our eyes and to wash out particles and grime that may have been stuck in them.
My initial thought when it comes to itchy eyes is usually an allergy, but there are a few other causes too. Watery eyes can happen in two ways. Either the tear drainage duct is not draining properly, or the eye is producing more tears than is necessary.
So besides allergies, the other options could include conditions like a clogged tear duct, dry eye syndrome, conjunctivitis or pink eye, or a foreign body or abrasion on the eye. You mentioned that he had kids, so that could predispose him to having pink eye because it spread so easily at school. Had anyone else in the family had similar symptoms?
No, it's just him. But he did feel as though he had tiny grains of sand in his left eye. They had been this way for about a week.
Okay, so his symptoms had been around for a while then. Did he have any allergies?
Yes, he did, to cats. But he was always very careful around them because he knew once he was around one, his nose would start running.
All right, did he have any other existing eye conditions, or did he wear contacts or glasses maybe?
No, he didn't, and he's very proud of his 20/20 vision and didn't struggle with any other eye-related problems.
Okay, so pink eye, abrasions, foreign bodies and allergies off the list. So that really leaves us with dry eye syndrome and a blocked tear duct.
And it's ironic that a condition that is called dry eye syndrome could be responsible for watery ones. But if the eyes are parched for some reason, a reflex kicks in that produces extra tears.
And that's another reason our bodies are so amazing. Now, differentiating dry eyes, though, from a blocked tear duct can be very difficult, but there are some key differences. The two most important are whether there was any discharge or crustiness in the eyes, or whether the itchiness and tearing affected both eyes or just one.
Johan says he's struggling with both eyes and that the only thing coming out of them was tears. So I was leaning more towards dry eye syndrome. But it was important to identify what could be causing the problem and obviously to eliminate it.
Yeah, the most common cause of dry eye syndrome these days is technology. I kid you not. I mean, on average, you blink around 18 times a minute, but you only blink half as much when you're looking at a screen, a PC, TV, or a phone. So obviously, the less you blink, the less you lube up your eyes, the more strained they become, and so the cycle continues. In fact, wearing contact lenses also predisposes him to dryness.
Other common causes include environmental changes like very hot and dry climates and good old aging. As we age, we create less productive tears, which evaporate quickly, meaning less overall moisture to your eyes.
Yeah. And were any of these to blame in Johan's case?
As it turned out, he had been working late for the past 2 weeks, finishing up on an important proposal for work. The desk light in his study had blown, and because he was on such a tight deadline, he hadn't fixed it yet. And as you said, staring into the screen for hours may strain your peepers.
Yeah. When burning the midnight oil, or in fact, anytime you're at your desk, remember the 20-20-20 rule. Look at something 20 meters away for 20 seconds every 20 minutes. Based on these symptoms, it's likely that this is a transient or passing condition, but anything long-term, and you'd need to see a doctor and ask him to keep an eye on it.